Everybody, Dr. Brandan Lee here from Immune Strong Families. I want to talk about head colds and the common cold, which is really just another example of a respiratory tract infection. A lot of people are wondering why they're getting colds outside of the traditional cold and flu season, and I think this is a part of the bigger trend that we're seeing, that people tend to get sick more often and have more trouble recovering than they used to in decades past. You know, it used to be that colds and flus were kind of contained in the late fall and winter months, cold and flu season. But now people get summer colds, they get, head colds year round. And so I wanted to make this video so we could focus in on a scientific journal article that was just published late in 2024. And it was published in the journal Nutrients. And in this study, what they did is they followed nearly 200 students ages 1 to 18 for 2 years of their life. And they looked at vitamin D, aspects of their life that revolved around vitamin D. So like dosage, how much vitamin D were the students taking, and what were their blood levels. And this study took place in Romania, which actually has a similar latitude to a lot of our northern states here in the US, states like Michigan, Wisconsin, South Dakota. So you can use that for reference based on where you might live. So what they did is they followed these 200 students, and here's an example of some of the findings. They looked at dosage. So some of the students were taking 400 IU of vitamin D. Another set of the students were taking 800 IU of vitamin D. Here's what they found. They found that the students who were taking the larger dosage were 75% less likely to get a respiratory tract infection. Basically, if you were taking, the kids taking more vitamin D were 75% less likely to get a cold, right? Pretty amazing. Now, they also looked at blood levels, okay? So they compared people who had a vitamin D level of 20 or lower to people who had a vitamin D level of 30 or higher. Now, just let me point out that if you have been following the work of Immune Strong Families or paying attention to vitamin D, you know that the optimal range is actually 40 to 60. So even these kids who had 30, they're not necessarily up there in the optimal range. But check this out. The kids that had a vitamin D level of 30 or higher were actually 78% less likely to get a cold or to get a respiratory tract infection than the kids who had the lower vitamin D level. So those numbers are incredible. And just imagine that for the students who actually had a vitamin D level in the optimal range, in 40 to 60, their numbers could be even better. So let me know what questions this creates for you, what comments you have, what concerns, what we can do to help you actually have an optimal vitamin D level so you don't have to be a victim to these things.